619 million people worldwide are dealing with lower back pain right now. It's the number one cause of disability on the planet. And yet, when most people feel it for the first time, the first thing they do is panic. They assume the worst: a herniated disc, a pinched nerve, something serious. Here's the uncomfortable truth: most of them are wrong, but some of them, a small number, are right to be concerned. The problem is nobody teaches you how to tell the difference. That's what this video is for. We're going to go through the 5 most common causes of lower back pain, starting with the ones you cannot afford to miss, and ending with what's actually behind most cases. By the end, you'll know exactly where your pain fits and whether you need to see a doctor today, this week, or not at all. Before we start, a quick word on how this list works. Most videos about back pain go from most common to least common. We're doing the opposite. We're starting with the causes that are rarest but most dangerous and working our way down to what's behind the overwhelming majority of cases. Think of it as the checklist your doctor runs through in their head every time someone walks in with back pain. Now you get to run it too. This category represents less than 1% of all back pain cases, but it's where we start because these are the causes that cannot wait. We're talking about vertebral fractures, spinal infections, and tumors, either primary or spreading from elsewhere in the body. The defining feature is pain that doesn't behave like normal back pain. It doesn't change with position. Lying down doesn't help. Standing doesn't help. It may wake you up from a dead sleep, and it gets progressively worse over days and weeks, not better. There are 4 red flags you need to know: fever, chills, history of IV drug use, or recent infection. Think spinal infection, unexplained weight loss over 10 pounds, or a known history of cancer. Think tumor, recent trauma or fall, especially in adults over 50 or anyone on long-term steroids. Think fracture, and loss of bladder or bowel control or numbness in the saddle area between your legs. This is a medical emergency called cauda equina syndrome. Go to the ER now. Do not wait. If any of these apply to you, stop watching and call a doctor today. This is not a wait and see situation. Early diagnosis in this category changes outcomes completely. This is the category most people jump to when they think back pain. And it's more common than serious pathology, but still not the most likely explanation. A herniated disc happens when the soft inner material of a spinal disc pushes out and presses on a nearby nerve. Spinal stenosis is a narrowing of the spinal canal, usually from age-related wear that creates similar nerve pressure. The signature symptom is pain that travels. It doesn't just stay in your lower back, it radiates down one leg, often past the knee, sometimes all the way to the foot. That pattern has a name: sciatica, and if you've seen our previous video, you already know it well. Along with the radiating pain, you may feel numbness, tingling, or weakness in the leg. Here's something most people don't know: approximately 90% of symptomatic disc herniations improve without surgery. Most herniations actually shrink and resorb over time on their own, and imaging can be misleading. These bulges and degenerative changes can show up in more than 50% of people over 30 who have no pain at all. This is why your doctor shouldn't recommend surgery based on imaging alone. Sitting for long periods makes it worse. Bending forward, coughing, or sneezing suddenly. If the leg pain is severe, if you have weakness, or if things aren't improving after 6 weeks of conservative care, you need imaging and a specialist evaluation. But if your symptoms are manageable and improving, time and guided physical therapy are usually your best allies. Your spine isn't just discs and nerves, it's a series of small joints called facet joints that connect each vertebra to the one above and below it. These joints can become inflamed, arthritic, or irritated over time, especially from age, repetitive stress, or poor posture. This process is part of a well described degenerative cascade that starts in most people in their third or fourth decade of life. The pain is usually central, in the middle of your lower back, not radiating down the leg. It's worse when you lean backward or twist to one side. Mornings are often the worst. The stiffness tends to ease as you move around and warm up. Facet joint pain is one of the most commonly overlooked diagnoses in primary care. Patients get told it's just muscle pain or degenerative changes on the MRI, without anyone explaining that the facet joints themselves are the source. Knowing this changes the treatment approach entirely. Physical therapy focused on posture, core stability, and spinal mechanics is first line. Anti inflammatories can help in acute flares. In persistent cases, targeted injections or minimally invasive procedures can provide significant relief. The sacroiliac joint, the SI joint, connects your spine to your pelvis. You have two of them, one on each side. When this joint becomes inflamed or starts moving abnormally, it causes pain that is frequently mistaken for a disc problem, which means patients get the wrong treatment for months or even years. The key clue is that the pain is one sided, left or right, not in the middle of the back. It's usually a deep ache in the lower back, the buttock, or the back of the thigh. It gets worse going upstairs, getting out of a car, or standing on one leg. It's significantly more common in women, particularly during and after pregnancy, when the pelvic ligaments are loosened by hormonal changes. It also appears frequently in runners and athletes who do repetitive impact activity. A targeted physical exam can usually identify SI joint pain, though it requires a clinician who knows to look for it. Treatment typically involves physical therapy focused on pelvic stability, sometimes combined with targeted injections when conservative measures aren't enough. We've made it to the bottom of the list, which is also the most important stop for most people watching this video. Muscle and ligament strain is the cause behind the vast majority of lower back pain cases. Up to 90% of patients presenting with back pain have what's called non-specific low back pain, where no serious structural cause is identified. The pain is diffuse, spread across the lower back, not pinpointed to one spot. It doesn't travel down the leg, no numbness, no tingling. It feels like a dull ache or tightness. Sudden movements make it worse, but gentle, sustained movement usually helps. Here are the actual numbers. Approximately 72% of people with acute, non-specific low back pain recover within 12 months, most within the first few weeks. This is not optimism. This is what the data shows. And here's something that might surprise you. Bed rest for more than 1 to 2 days actually slows your recovery. The evidence consistently shows that staying gently active, continuing your normal routine as much as possible, leads to faster improvement than lying still. For first-line treatment, heat application works. Spinal manipulation by a trained provider, massage, NSAIDs like ibuprofen, and perhaps the most underrated, simply moving, walking, staying active. One thing worth knowing about pain relievers: acetaminophen, Tylenol, has not been shown to improve outcomes in low back pain compared to placebo. If you've been reaching for it automatically, the evidence says it may not be helping. If your pain hasn't improved after 4 to 6 weeks of conservative management, if it keeps coming back repeatedly, that's worth evaluating with a specialist. Recurring episodes are a signal that something mechanical may need attention: posture, movement patterns, core stability, or an underlying structural issue that hasn't been identified yet. So here's the framework. Start at the top. Rule out the serious causes first. If you have red flags, fever, unexplained weight loss, bladder changes, pain that won't quit at rest, don't wait. See a doctor today. If you have pain that travels down your leg, especially past the knee, that's nerve involvement and it needs evaluation. If your pain is one sided and deep in the buttock, worse getting in and out of cars, think SI joint. If it's worse leaning back and stiff in the mornings, think facet joints. And if it's diffuse, non radiating, worse with movement but improving over days, odds are heavily in your favor. Give it time, stay active, and skip the bed rest. Now, here's something that surprises a lot of people. Not all lower back pain comes from your spine. In our next video, we're going to cover the causes of back pain that have nothing to do with vertebrae, discs, or nerves, kidney problems, abdominal conditions, and others that mimic spinal pain closely enough to fool both patients and doctors. Knowing the difference could change your diagnosis entirely. If this helped you make sense of your pain, subscribe. Every video on this channel is built to give you the same level of clarity your specialist would give you in the office. Drop your questions in the comments. I read them.